Good day, everybody. My name is Boaz Rochtel. I'm a medical cannabis activist for the last 15 years. I started the issue in Israel, and we've made huge progress in the last. Israel today has a national medical cannabis program with over 10,000 patients, served by 8 growers that are chosen by the government agency to regulate the issue. We educate the patients how to use the medical cannabis, and Israel is one of the leaders in the world in terms of medical cannabis research, and we have in the program cooperation, for example, between the Department of Defense, who are dealing with the consequences of PTSD, of war veterans, who are not being helped by current medications. And in a recent pilot study on PTSD and cannabis in Israel, the consequences of using medical cannabis for these PTSD war veterans was so positive across a spectrum of symptoms that it's now going to expand this study. And I think that if the Israeli Ministry of Health and the Department of Defense could cooperate with the U.S. Department of Defense to study how this issue could help these brave men and women who serve the country and are being neglected today, and their access to safe and effective medicine for their condition is denied from them in this country, which is very, very sad. So I urge you to get involved and actively pursue a policy that would get the federal government involved both in research in this country on PTSD and other issues that medical cannabis helps, and also in terms of international cooperation with other countries on the study of medical cannabis. What we see is that medical cannabis is also good for the insurance companies. In Israel, they did a survey among elderly people who consume 8 or 7 or 6 medications, and when they get on medical cannabis, they throw away 4 or 5 or 6 medications. And suddenly they sleep better, they eat better. These are 80-year-old people or 90-year-old people. And it is tremendously beneficial for the insurance companies because they look at things only from an economic point of view. So this is one angle that is really should be touched. And Israel is not the only country outside the United States with a national medical cannabis program. There's the Netherlands, they were the first in 2003. There's Canada, the second country, and Israel is the third country. And now the Czech Republic is the 4th country in the world that has a national medical cannabis program. And the government and all its elements have to come together and cooperate on this issue, which has to do with showing compassion to sick and very sick and dying people. And if the current pharmacopoeia does not work, it is the responsibility of politicians to make sure that people have access to medical cannabis and to help these people find relief from their symptoms. Thank you very much.